We have to spell it out. In some cases, it won't be nice or it won't be pretty, but we have to do it. When you hear 10,000, it was 1 in 10,000, and now it's 1 in 31 for autism. I think that's just a terrible thing.
So that there is the president's initial reaction to RFK Jr.'s MAHA Commission releasing a major report on children's health. Paints a dismal picture. Dr. Mark Siegel here for us on this today. And Doc, nice to see you, and good morning to you. I want to read some stunning numbers.
How are you?
Really stunning numbers. We're fine. Thank you so much. ADHD up 250% between the years 2000 and 2016. Antidepressants up 1,400%. Antipsychotics up 800% starting the year 1993. I'm just on his face, these headlines are stunning. But you as a doctor, as a physician who sees patients, what do you think the headline is from this report?
The headline from this report, and I read it thoroughly, I got it at 5 a.m. yesterday in advance, is that it's all connected. The dots are connected. We have an obesity crisis in this country with our children over 20% obese, 40% with some chronic illness, sedentary behavior. Listen to this, Bill. The majority of high schoolers don't exercise more than an hour a day. Most don't. They're not exercising. They're on screen time. More than 3 hours of social media doubles your risk of being depressed or anxious. So picture this. Kids that are not eating properly, 40,000 chemicals in our environment or in our foods. They're being exposed to ultra-processed foods. That's 70% of their diet. They're lying around. They're on social media. They're not interacting enough. They're gaining weight. And then, and this is another key thing about the report, and then they get treated with medication. They're more prone to get sick. They get antibiotics too much. They're more prone to get depressed. They get antidepressants too much. Now, that's the thrust of this report. It's all stitched together. We weigh too much. We eat poor food. We're not sleeping enough. We're too anxious. What to do about it? They're going to start a lifestyle campaign here to dial this back and start earlier before people get sick.
I want to put a spotlight on what the HHS Secretary said, RFK Jr., about the role of foods. Listen to this real quick.
It's common sense that ultra-processed, nutrient-poor food contributes to chronic disease. It's common sense that excessive screen time and isolation lead to anxiety and depression, especially in children. It's common sense that exercise and healthy food should come before prescriptions and surgery.
So I just heard you say 43% of the environmental chemicals that we encounter are in our foods. How do you get around that? Do you have to regulate your way out of it? I would imagine that there's already demand for nutritious food, but people probably just can't afford it.
Great question, Jackie. First of all, regulation. I think that the key is incentivizing on SNAP programs state by state healthier foods. This is an addiction. This is an addicted society. We have to transition off of addiction to bad food onto good food. Arkansas adds rotisserie chicken to SNAP. Now, I don't know if rotisserie chicken is totally healthy, but it's a heck of a lot better than eating candy bars. So that's how we have to do it. We also have to study things more because he's going to have a big fight against lobbyists here. So we got to use artificial intelligence, transparency, more post-market studies so we have more and more data. The report is data heavy on what's wrong. We need more data on what to do about it.
Just a quick answer on this. This is all in part to educate the American people. Do you find that your patients are asking about this now more than ever or not?
No question about it. You know, they come in and they ask, well, can I have that great weight loss drug? But they also want to know, how did I get like this? What can I do about it? Bill, I use it to open a conversation about exercise, sleep, stress. What's bothering you? Doctors have to go back to that. What's bothering you?
Okay.
Hopefully AI will free up our time.
All right, we'll work on that. Thanks, Doc. Nice to see you.
Good to see you, Dr. Siegel.
Mark Siegel, thank you.
Great to see you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.